South Korea has seen yet another drop in the number of new COVID-19 infections. In a briefing earlier this morning, Prime Minister Kim Boo-kyum says that while constant monitoring will be needed, the country is getting over the hardest part of the pandemic. The government added more efforts need to be focused on bringing down the number of critically ill patients and deaths because we will see these figures still spike in the next few weeks. Shin Ye-eun reports.
South Korea on Friday reported 339,514 new COVID-19 infections. This was down by roughly 56,000 from a day ago. To that, the Prime Minister said the country is seemingly past the worst.
Compared to last week, we're seeing 50,000 fewer infections each day on average. Though we still need to see whether this downward trend will continue, I think we can say that we're getting over the hardest part.
The Prime Minister cautioned, though, that more efforts are needed to reduce the number of deaths in severely ill patients because these figures usually lag 2 or 3 weeks behind infections. On Friday, 393 more people died, marking the third highest number of deaths since the pandemic. New efforts in Korea's COVID-19 strategy include giving out more antiviral pills. Supplies of antiviral pills in the country are running low as some 7,000 courses of Paxlovid are being given out per day. That's why authorities have decided to bring in the pills contracted for April earlier than planned. They're also currently in the last stage of negotiations to secure more Paxlovid deals. Officials have also decided to provide 100,000 courses of Lagevrio from Saturday, which marks the second oral COVID-19 medication to get the green light from the Ministry of Food and Drug Safety in Korea. They will be given to those at high risk who can't take Paxlovid due to it clashing with other medication. Another new measure authorities are considering is to stop giving out rapid antigen tests at all screening clinics. This means that only people at high risk will be tested by medical staff with a PCR test. Everybody else will have to use self-testing kits. And authorities are considering providing these kits at the screening clinics. So far, most districts have agreed to this decision in the hope that medical staff out at screening clinics can instead focus on treating patients. If discussions go as planned, this change could come in from April 4th. This is also when the next changes to the social distancing measures are expected. Shin Ye-eun, Arirang News.